Colorado has already ordered its first shipment of the COVID-19 vaccine. Nearly 47,000 doses should be on the way soon. That's if the Pfizer vaccine is authorized for emergency use by the FDA Thursday as expected. Pfizer plans to ship the vaccine within 24 hours of being authorized. Frontline and medical workers and those living in long-term care facilities will be vaccinated first. Alan Janae joins us tonight. And Alan, 47,000 doses isn't nearly enough for those two groups.
Well, it's not, Michaelia. If you think about the math here, there are about 180,000 inpatient hospital workers in Colorado. So the state's team is trying to figure out who should get the vaccine first. And hospitals and long-term care facilities have a lot of figuring to do as well.
We want to keep the COVID outside of the building.
That's the first goal for Robin Avery and his wife, co-owners of the Retreat at Church Ranch in Westminster. They've been able to keep residents of this long-term care facility from getting infected with COVID. They recently did have a couple staff test positive.
To the extent that the vaccinations assist in that, we couldn't be more happy that they're coming down the pike.
Avery plans to talk with physicians groups they've partnered with for years, but may have to look at priorities.
We've had this argument over the years, who's more important, the staff or the residents? It's an argument that we'll have forever.
He expects both to get it the same day. Hospitals, too, are having the discussion.
Kind of that question of the chicken and egg, like which is the best way to approach this to be able to A, get the pandemic under control, and B, ensure that we still have healthcare workers.
UC Health Hospital's Dr. Michelle Barron is part of the effort.
I think the people that are seeing patients are going to be the ones that will probably get access to the vaccine first, just because they are obviously potentially higher risk for being exposed to COVID in the first place.
Expert advice will mean everything, says Avery.
Together, we'll make a decision to start a vaccination and inoculation program. And the sooner the better, frankly.
Well, Avery says here that if it looks like things have been rushed, they may slow them down. But experts are saying that the reason that the trial timeline has been shorter has been to limit financial risk. But the trials have been conducted in the same fair way that they have in the past. And experts are saying that these vaccines are the results, truly, of decades of development, even though they've come together just this year. In Denver, I'm Alan Janae, covering Colorado First.
Thank you so much, Alan. Hospitalizations across the state continue to climb. More than 1,600 people are being treated for COVID in Colorado hospitals. 205 new COVID patients were admitted to the hospital in the last 24 hours. 48% of critical care ventilators are in use across the state.